Hello, this is Senge Macaulay, one of the students of the Essential of Nursing Research course. The topic I chose is hand hygiene compliance. Okay, I'll be talking about the objectives regarding my topic. The objective of my presentation is to provide a critical appraisal of the research and summarize the knowledge available on hand hygiene compliance. In this presentation, I will also outline a strategic plan for implementation of practice change in a clinical practice environment to improve hand hygiene compliance. I used 6 articles to do my critical appraisal, and the first article that I used was written by Binberg, ETL 2017. It is a peer-reviewed source that discusses hand hygiene compliance. The article investigates the effects of science on hand hygiene compliance, and the results of the survey indicates that science have little influence on hand hygiene compliance, even if they are derived from evidence-based sources. The second article that I used to do the critical appraisal is by Kyo and Van. This article was published in 2015. This article investigates the effects of location on hand hygiene compliance. The researchers in this article investigated the effect of visibility and accessibility in 12 units and found out that 2 factors enhance hand hygiene compliance. One is the location, which is an important factor in increasing hand hygiene compliance. The third article that was used was an article by Kyo, Van Ink, and Chung that was published in 2014, and it also investigates the effect of location on hand hygiene compliance. The researchers in this article analyzed the criteria that can be used in choosing the right location for hand sanitizers. They concluded that placing hand sanitizers at entrance of units in hospitals or clinical settings increases compliance due to visibility and accessibility. Another article that I use, which is the 4th article on critical appraisal, is an article by Cloyes, and it was published in 2015. In this article, it was investigate the reasons The review investigated the reasons for compliance to hand hygiene methods. The researchers investigated the instances of violation and suggested possible intervention methods that can be applied to increase compliance. In the article, it was concluded that emphasizing the importance of hand hygiene in reducing the rate of hand hygiene helps to reduce the rate of hospital-acquired infections. The 5th article that I used is by Hobbs, Robinson, and Stade. This article was published in 2016. In this article, the researchers investigated the use of hand sanitizer by visitors based on characteristics and location in the hospital setting or lobby. They sought to evaluate the effects of characteristics of the visitors and location of the sanitizers in increasing compliance. The results indicated that placing the sanitizers in a location that is easily accessible and visible increased compliance. In Article 6 by Gold et al. was published in 2016. The researchers evaluated interventions that can be utilized to improve hand hygiene compliance in healthcare settings. The results of the study indicated that the importance of utilizing varied methods in increasing hand hygiene compliance in critical settings help to avoid infections. The combination of different methods is essential as it helps in enhancing rates of compliance. The strategic plan for implementation that I use is to change. The strategic plan for implementing change involves utilizing a combination of intervention strategies. The methods that were implemented included increasing the number of sanitizers, increasing accessibility and visibility, utilizing educational methods to illustrate the importance of hand hygiene methods on preventing infections, and placement of reminders and signs. The human error model will be used for implementing the change that is required. Operationalizing the practice change in my practice environment. Allegrazi et al. 2010 proposed 4 steps of operationalizing practice relating to hand hygiene improvement in practice environments. The 4 steps included preparedness, baseline evaluation, intervention and implementation, and follow-up evaluation. During the preparedness period, which may take about a month, the staff at the hospital must assemble the required resources, the equipment and infrastructure needed. Baseline evaluation entails an assessment of self-reported perceptions towards hand hygiene. This will help implementers anticipate outcomes and adapt their strategies in a way that might improve those outcomes along the way. And during the intervention process, the strategy is formally launched and all activities are rolled out. Hand washing equipment is put in place, educational sections commence, posters are displayed, and data gathering on progress of the strategy is initiated. Follow-up measurements can occur at 2 stages: immediately after strategy delivery and later on in 6 months since the end of the strategy delivery. Focus here will be on cooperative efficacy surveys on different hand washing agents. The theoretical model that I use in the operational module is the human error model. The human error provides a philosophical conception of error based on 2 perspectives: personal approach and system approach. In personal approach, an error is considered a procedural violation, while in the system approach, it is considered an inevitable part of organizational operation. During this operationalization period of the hand hygiene strategy in a practice settings, implementers will endeavor to strike a balance between those errors that constitute procedural violations or unsafe acts and those that constitute an inevitable part of organizational operations. For the most part, all stakeholders will be encouraged to treat failure to wash hands according to guidelines as a procedural violation. Ways of overcoming barriers to implementation. First, the staff must be educated on the importance of hand hygiene in a healthcare setting. Secondly, they will endeavor to team up with everyone in the care facility in fostering an institutional safety climate. The third activity will involve carrying out feasibility studies on effectiveness of strategy. The team will promote a culture of visibility participation, especially by leaders and healthcare facilities. Sources of internal evidence for promoting data to demonstrate improvement in outcomes. The main source of internal evidence will be performance feedback during strategy delivery. Other sources will include feedback sharing, responses from feedback, questions regarding self-reported perceptions, comparative analysis of recordings of actual hand hygiene practices vis-a-vis practices described in baseline data, as well as insights from cooperative efficacy surveys on different hand washing agents. And the last but not least will be evaluation of the methods. Evaluation will be conducted through collecting data on hospital-acquired infections and comparing this data with previous statistics before the implementation of intervention strategies. Reduced number of infections will indicate an increased rate of hand hygiene compliance. And below, you will have my references. Thanks.